Hi everybody, I'm really excited to be here today and excited to participate with you all in our first educational symposium. So our talk to kick off our meeting is a project that we did as an assessment of program director and resident needs for a structured introductory radiation oncology curriculum and boot camp. And so just thanks for everyone, all the co-authors on this project, and we'll get started. So I'll give you a little bit of background. So actually many medical specialties and subspecialties have actually implemented courses to teach fundamental skills and knowledge to new trainees, and they kind of fondly refer to these programs as boot camps, right? So this was first piloted by the neurosurgery program, where they set up these 6 regional boot camp courses for PGY1 residents. And this was intended to promote quality, patient safety, and professionalism. And the reviews on this, both in kind of the subjective, how did we like this, as well as the knowledge assessments, were quite favorable. And because of the significant improvements, this became very popular with even other subspecialties. So here we see a picture just of one of the neurosurgery boot camps going on at Cornell. And you can see that on their website they advertise that they invite all the residents at the end of their PGY 1 year to participate in this. And this neurosurgery program published this. And because of these favorable results, many other medical specialties have actually also adopted this concept. And you can see that here. This is thoracic surgery. We have another neurosurgical one, neurosurgery for mid-level providers, cardiovascular fellows boot camp. And so not only have these boot camps been established and set up, many have also published on the efficacy of these. So you see publications on emergency medicine, educational theories, boot camp for pediatric critical care, pediatrics family medicine, and there have been actually so many publications that we even have reviews of boot camp publications. And so, the logical question is, we in radiation oncology are actually the small kind of subspecialty that doesn't get a lot of press in the normal med school curriculum, and so it might make sense for us, even more so than some of these that are represented in med school curricula, to have one of these boot camps. So the question that we asked is, would a radiation oncology boot camp or a standardized introductory curriculum improve new radiation oncology resident confidence and competence when they show up that first day to start their rad-onc career? And so to do that, we came up with a needs assessment study that had several aims, and they're kind of in 2 parts. So the first is those related to the introductory, some kind of introductory curricula, whatever the kind of structure of that would be. And so we wanted to assess the relevance and efficacy of the current introductory curricular program. So do you have one? What is that? We wanted to evaluate the competence of residents and the competence of program directors in their residence to function in clinic both before and after this introductory curricula, and then evaluate the optimal timing and components. The second part is kind of more like specific kind of introductory curriculum in the form of this kind of off-site centralized boot camp type thing. And so we wanted to gauge the need for that and the interest in having some type of centralized boot camp. So to do that, we sent out an anonymous web-based survey. We surveyed all of the program directors or the program directors that were at the time and all radiation oncology residents. And the questions that were involved were yes, no, like or type, and then free response questions. So the results from this, surveys are always challenging to get good response rates. We had about a quarter of the residents respond and a little over half of the PDs respond. And something to keep in mind as we go through the results is just that we obviously can't guarantee that the residents and program directors were responding from the same programs. And so comparison of some of those data is a little bit challenging as well. But we do the best we can. So if we take a look at who actually did respond to the survey, we see that we had good representation of PGY 2s through 5s all years. Most of the residents were from programs and program directors, moderate-sized programs that had about 5 to 12 residents. And about 20% of both the residents and PDs say that their first-year residents have exposure to radiation oncology during that intern year. The first question that we asked is, are residents prepared for clinic when they show up? Before anything, can they do the job that they need to do? And what we see is that on the left, we have the resident answers. On the right, we have the program director answers. And there's already quite a discrepancy there that one would predict, right? So 80% are saying, no way, I can't do this. 45% of the program directors are saying, it's going to be fine, like you're not that bad. Or they're saying also no, the opposite. Also, this is an interesting question. So program has formal introductory curriculum. The residents would say half and half. I have something, I don't have something. Whereas the program directors are like, yes, absolutely, 80%, we have something for you. And so that's another interesting kind of take-home point or something to think about, like the discrepancy between how much is actually needed to make a resident feel that like I had training, as opposed to the program director who thinks that maybe a couple introductory sessions or some admin time, is good enough. As far as the timing goes, they thought that the ideal curriculum is about a week in length, but there's some variability there. So the second question that we asked is, do you feel prepared for clinic after the introductory curriculum that you had, if you had one? And what we see again is that same discrepancy. So the residents did feel a little bit better after their introduction. So now we're down to about 40% as opposed to the 80% who said, I don't feel at all prepared. The program directors now think that only 16% of their residents are not at all prepared after their introduction. As far as what perceived benefit they get from the formal curriculum, residents say it was about moderate. And then another interesting thing is if you ask the residents who had no introductory curriculum, how beneficial do you think introductory curriculum would be, they say extremely. So other than that on here, what you can see is just some other data on kind of the timing of the programs that they had. And so again, most of the programs are kind of 1 to 2 weeks in length. And program directors were also asked if they do any evaluation of their introductory curricula, and most do not. And that was an open-ended question. That could be, we didn't ask, do you send out formal surveys? Do you do any kind of evaluation? And the answer was mostly no. So these are notable comparisons that we've kind of already addressed, but basically program directors feel that the residents are far more prepared than the residents feel they are. Residents do feel that the introductory curricular materials that they have do improve their kind of feeling of readiness for clinic, but it's not extreme. Program directors also feel that it does improve that. No significant differences were seen when we kind of separated out the PGY2 population or the PGY5 population. We thought that there might be differences based on how far away you were from that initial training or how close you were to it, but no differences there. So the second part of this study was really asking questions about specifically this boot camp idea. And so we again asked residents and program directors, residents on the left, PDs on the right, do you think that this would be effective or useful? And residents felt that it would be slightly more useful than the program directors, but everyone felt like there was probably a benefit to this. Of course, residents are willing to miss a clinic day, and of course they're willing to travel if you're going to provide them funding. No shockers there. But unfortunately, that is really kind of the take-home of this boot camp, is that funding is a limiting factor that both residents and program directors cite as being why this potentially would be unsuccessful. So what we also asked both the residents and the program directors, we gave them ideas about what kind of components could be included in either an introductory curricula or a boot camp or both, but basically what kind of things do you want to be taught at that initial step, when you're coming before you go to clinic. And so there are things on lectures on patient simulation, patient setup, radiation emergencies, several hands-on kind of workshop type options, treatment planning, contouring, normal structures, targets, and then some down here are lectures on clinical diseases, radiation biology. So I have the residents are here, and you can see that the first question is, would you include this component in an introductory curriculum? And then the second is, how much do you think that this absolutely needs to be included as part of a boot camp? These are the program director responses, and then they're ranked here. So the most highly rated components are on the top. They're ranked by the resident responses, but it was pretty much even between the responses of the PDs and the residents. And the things that were most rated are the things that are most practical. So they want to know, how do I contour? How do I do some basic treatment planning? Yes, can I please have some hands-on workshops? Please help me to know how to handle radiation emergencies. These are all things that I should walk in the door having some kind of a handle on. So basically, what we took out of our study from the introductory curriculum portion of it is that RO residents do lack structured introductory curricula, and they do strongly desire this. They feel like it would be most helpful if it's prior to clinical duties and then possible with some kind of reinforcing activities throughout that first year. And they would like it to focus on practical aspects. So emergency management, contouring, like we spoke about. As far as the offsite boot camp goes, I think people felt like this is a great idea, but logistically, how can this happen is challenging, and funding is the major barrier. And so a virtual boot camp was one thing that's suggested, which there's both pros and cons to that. Some things are better experienced in person, but also an on-site introductory curriculum, possibly a structured introductory curriculum, would be a way to solve that problem. And so the efficacy of any boot camp or intro curriculum does need to have careful evaluation, and fortunately we have a talk coming up here that's going to kind of walk us through how that could happen. So, but I'd just like to thank everyone who participated in this, and